Welcome back. Now, today marks International Nurses Day, and it's a day to mark and honor the contributions made by these professionals across the globe. Now, with the global theme today being nurses, a voice to lead, a vision for future healthcare, the focus this year is centered around strengthening innovation in the nursing sector. The day also comes as nurses are on the front lines in the fight against the global COVID-19 pandemic, with scores of nurses across the world having been infected and even dying from the virus. So while the day is meant to honor and celebrate, it is also a reminder of the many challenges that nurses face while executing their duties. Sicina is a nurse and also the General Secretary of the Young Nurses Indaba Trade Union, and he joins us now to share some of his views on this Nurses Day. So, Rich, good morning, and thanks so much for being with us. Welcome to Morning Live.
Good morning. Thank you for having us. Yes.
So this year, of course, as I said in the intro, it's meant to be a celebration, but against this backdrop of a global pandemic. What are your thoughts immediately on today as World Nurses Day?
Like it happened last year. This day happened last year in the midst of a great pandemic that has claimed a lot of lives. Our colleagues are no more, and the others are still dying, even though the numbers have dropped, and there's third wave looming. Even this year, it's still happening in the midst of that, and we were hoping that because even before the pandemic, under normal circumstances, our healthcare system in South Africa, public healthcare system in particular, was under attack. We were going out there as nurses. We were complaining every day about gross shortage of staff, about gross shortage of material resources. We thought as young nurses in Indaba Trade Union and all young healthcare professionals, nurses in particular, that after a year, maybe South African healthcare system, those in positions of authority will have done something to boost numbers in terms of human resources. We were not going to see ourselves still complaining about patients who can't be taken to ICUs. We were hoping that verbal salutations were going to come to an end, where because of the pandemic, maybe our government will say, let's reverse our decision to stage a zero wage increase until 2024. Yes, we are still going out there. We are proud of what we are doing. We are proud of being nurses in this country, but we are still frustrated.
Evidently, and of course, as you say, you're hoping that there may be a change of heart somewhere along the line with regard to the salary negotiations. But apart from that, in terms of just capacitating nurses to do their jobs to the best of their ability, how would you say things have been over the past year?
May you come again? I didn't get your question.
I was asking about the salary issue aside. It is, of course, a big one that we cannot gloss over. But apart from that, just in terms of other support and being capacitated to do your job to the best of your ability, how has that been over the last year for the nursing fraternity?
In terms of we thought again we will put things in place in terms of having a team. As young nurses in Indaba, we suggested that let's have a team of educators. We have educators who were sitting at home the most part of last year. We were saying utilize them to go to different institutions across the country, educate nurses about this pandemic, about the vaccine, so that when we go out there to the community, we go out there as informed healthcare professionals. But again, in terms of that, that didn't happen. We are still having a lot of nurses who are unemployed. It's crazy because every day when we are working in our line of duty, we still struggle. We still nurse 45 patients, and you are only 3 on duty. And we look at ourselves sometimes and like, what's happening in this country? Even a pandemic didn't really knocked some sense to those in positions of authority. We still have nurses who are unemployed during a pandemic. So it's frustrating. As we speak, there are those who have just completed. Their 4-year course as professional nurses. They are in the system at the moment as we speak, but they are still not. They haven't yet paid.
Well, our apologies in terms of that picture to Rich just breaking up every so often, but we'll obviously try and continue the conversation, and hopefully the picture will come back to us. But Rich, and I hear your frustration, and especially at a time when healthcare workers have been at the front line, have been literally in the trenches of fighting this pandemic. Rich, I just want to see, I see you speaking. My apologies, because the link is corrupted at the moment and we are losing you, Rich. But if you can hear me now, I'm basically trying to, get further on to the road of your frustration as nurses, because you speak about the lack of support in terms of just sheer numbers and where you are stretched as nursing personnel on the ground. But also, one of the things that was very evident was your unhappiness at the onset of this pandemic about just the lack of personal protective equipment, for one, as tools of trade that you were experiencing. How has that situation developed? Is it now resolved, or are you still experiencing problems in this regard?
That is why we are extremely disappointed to our authorities. And I was telling someone 15 minutes ago to say we are throwing ourselves into the deep end. We are tired. We are even tired of complaining. We are even tired of complaining about PPE. When we are told there's no PPE, we don't complain anymore. We just continue working. There's no PPE in our facilities. Sometimes we will have to phone. Where I'm working, sometimes we'll have to phone different hospitals asking to give us like few boxes of PPE because we do not have it. And we are told that even at that depot where we collect this particular PPE, there is no PPE. And even other hospitals will be complaining to say, we can't give you PPE. The only thing we can assist you with are masks. And those are surgical masks. So in as far as us being ready, at some point, I was saying, even with this third wave looming, if it can come, it will still find us wanting. We will still be exhausted, and we will still complain and talk again about PPE, because we were supposed to be having PPE right now ready for the looming third wave. But no, it's a different story. Things are just the same.
What about the vaccination rollout program for healthcare workers?
The vaccine rollout program is happening currently, even the way it has been structured as well. We were questioning the number that they want to reach. Are they going to reach those numbers? Because currently in Gauteng in particular, all healthcare professionals who want to vaccinate, they go to Bara. And we are asking why is this vaccine, for those who want to get this vaccine, why it is not distributed to different facilities, to all facilities in particular? Why do we have to have 10 people or 5 people per day in a hospital that has more than 2,000 people? You only take 10 and go to Bara for vaccination. Why don't we just distribute this vaccination for those who want to vaccinate, so that we can reach this herd immunity that we need to reach? But the way we are moving, the process is very slow. It's happening. Yes, those who want to get it, they do get it, but the process is extremely slow.
It's a very gloomy picture that you paint for us, Rich, with regard to the conditions under which nurses have to work. Is there anything to celebrate?
The only thing to celebrate is our existence, is us to celebrate ourselves as nurses, to say to ourselves we are more than the backbone of this healthcare system. We are the heartbeat of this healthcare system. We are really, the pandemic has proven that we are really the last line of defense. When everything has failed, you come to us. We are facing there's actually, we only have ourselves to celebrate. That we've been steadfast, we've been militant, we've been radical. But in a country that has an alarming rate of unemployment, inequality, poverty, and also these people who are poverty-stricken, they come to our facilities. And these facilities, they are going to get gross shortage of staff and gross shortage of material resources. That simply means they are still going to get, at their most vulnerable state when they are sick, they are still going to get substandard performance, because as a nurse, as a professional nurse myself, I can't divide myself into 10. I can't. So you nurse 45 of them. There's no way you are going to produce quality nursing care or medical care. There is no. We still have patients who die because a bed in ICU, there was no bed in ICU. If there is a bed in ICU, there's no nurse to nurse that particular patient. We still have patients who die prematurely because theater is busy. There's no space. Even now, after a year, there is no hospital that we are pointing at to say this hospital was built because of COVID-19. Yes, the only thing to celebrate is us, is the fact that nursing exists. We love it. We love what we are doing. We are still hopeful, and we have faith that things one day will change under the leadership of young nurses in Indaba Trade Union. With what we are trying to do, those in positions of authority will one day realize that failing healthcare system in South Africa is failing the entire country. Actually, in terms of healthcare system in South Africa, there's nothing to celebrate.
And on that very, very somber note, we have to leave it. Thank you so much. That was Nurse and General Secretary of the Young Nurses Indaba Union, Rich Sicina, talking to us about, well, it's a global celebration for nurses, International Nurses Day. But as Rich says, there is much still to be done, and nurses are unfortunately still not working under optimal conditions. And this is unfortunately where we come to that part of the show where we have to say goodbye.